Factor V Leiden is a common inherited blood clotting disorder that increases the risk of forming life-threatening blood clots. In this mnemonic video, we'll cover everything you need to know about Factor V Leiden so you'll be ready for the wards and the boards. Yikes, watch your head! We're chilling out in this fancy hotel's guest lounge today. But today just so happens to be the day they're renovating the lounge. That big 5-light chandelier has clearly got to go. It's in everyone's way. By the way, these 5 lights will serve as your memory anchor to Factor V Leiden. Get it? 5 lights for Factor V Leiden, or 5 light den, if you will. Factor V Leiden is a blood clotting disorder that increases the risk of forming blood clots in the body. Let's keep going to find out what causes this disorder. This hotel bar puts a lot of care into decorations. Along with the fancy chandelier, they put out a bowl of fake ceramic fruit on the table. Unfortunately for this kid, he thought the fruit was real. He even tried biting into that 5-pointed star fruit. By the way, this fake 5-pointed star fruit should help you remember mutated Factor V. Get it? Because a 5-pointed star fruit is our recurring symbol for Factor V. And this isn't any ordinary star fruit. Nope, it's a fake ceramic one that is resistant to breakdown. Almost like it's altered or mutated, wouldn't you say? Factor V Leiden is caused by a mutation of the Factor V. This leads to a mutated version of the clotting factor that is resistant to degradation, just like our fake star fruit here is resistant to breakdown. We're actually at this fancy hotel for a special conference on computer science, or CS for short. Looks like Dad brought his CS textbook and is trying to get his baby interested in CS early. But as you might expect, the kid is rejecting the book because he's way more interested in the fruit decorations than a boring old CS book. You might even say he's resistant to CS, which should help you remember resistance to proteins C and S. You see, the mutation of Factor V creates a clotting factor that is resistant to degradation by activated protein C and S. For context, protein C and S are anti-clotting factors that normally break down clotting factors to stop blood from clotting. Factor V that is mutated becomes resistant to breakdown by these two proteins, and as a result, the blood becomes hypercoagulable. Unfortunately, it's not enough to just know that a mutation in clotting Factor V causes resistance to breakdown. You actually need to know the exact mutations that cause the most common forms of this disease. Not everyone's here to relax. See those workers moving heavy gym equipment around? I guess they've decided to turn the lounge into a gym. That means that fancy TV's got to go to make room for this big glute machine. Too bad, my favorite team from Argentina was on. These workers swapping the TV playing Argentina for the glute machine should help you remember a point mutation that replaces arginine with glutamine. Get it? Since Argentina sounds like arginine and glute machine sounds like glutamine, right? A point mutation in the gene encoding Factor V causes an amino acid change from arginine to glutamine. Since this amino acid is normally the cleavage site for activated protein C and S, the mutation prevents Factor V breakdown by the reasons we covered above. What's more, even though there's construction work going on, the hotel's complimentary happy hour is still going strong. Note that sign reads happy hour from 5 to 6. This 5 to 6 actually looks like the number 506, which should make it easy to remember positions 506. The point mutation swapping arginine for glutamine happens at position 506 in the protein, or the 506th residue in the chain. Next, these workers obviously need a big moving truck to carry all this equipment around. See that big moving truck parked out back? This big automobile looks pretty imposing or dominant, which should help you remember autosomal dominant inheritance. Here at Pixarize, we use big or dominant autos like trucks and tanks to symbolize autosomal dominant inheritance. Factor V Leiden is an autosomal dominant genetic condition, meaning that it often affects multiple members of a family. You might have noticed that all the people in the scene happen to be Caucasian. This is just a little cue that Factor V Leiden is most common in Caucasian people. This is a less important fact to remember, but we just thought we'd touch on it for completeness. Okay, now let's touch on the actual clinical findings of Factor V Leiden. Since they're renovating this room into a gym, I guess the hotel is repainting the walls while they're at it. This vibrant red does put me in more of an active mood. They should thin out that paint though. This old tube's all clogged and the red paint is even clumping up on the wall. These red clumps of paint should help you remember the formation of blood clots. Get it? Because blood is a red liquid, kind of like the red paint here, and the clumps of red paint are kind of like the clumping of blood to form blood clots. Patients with Factor V Leiden classically present with recurrent blood clots due to overly high levels of clotting Factor V. This can manifest as clots in the deep veins of the legs causing deep vein thrombosis, the lungs causing pulmonary embolisms, or even the brain causing cerebral venous sinus thrombosis. Uh-oh, this worker got so distracted by the swinging chandelier, he snapped the handle clean off the baby stroller. This broken baby stroller should help you remember miscarriage, because strollers are for carrying babies and this one's broken, right? Factor V Leiden can cause an increased risk of miscarriage or recurrent pregnancy loss due to clotting in the placenta. Recall that the fetus gets its oxygen and nutrients from mom by way of blood flow through the placenta. If the mother has blood clots in the vessels supplying the placenta, this blocks off nutrients and oxygen reaching the baby, resulting in miscarriage. Finally, take a look at that can of paint thinner. They obviously brought this in after noticing all the clumpy red paint. This paint thinner should help you remember anticoagulants or blood thinners, the main treatment for Factor V Leiden. Get it? Since anticoagulants thin out the blood, right? Patients who develop severe or life-threatening blood clots are treated with anticoagulants. For patients who develop recurring blood clots, a chronic maintenance dose may be necessary. Notably, these patients should also avoid external causes of clotting, such as the use of oral contraceptives or hormone replacement therapies. Alright, that's all for this mnemonic. Let's review what we've learned. Factor V Leiden is an inherited autosomal dominant condition that increases the risk of forming large, life-threatening blood clots. This disorder is caused by a point mutation in Factor V at position 506, which changes an amino acid residue from arginine to glutamine. As a result, the mutated Factor V becomes resistant to degradation by protein C and S. This disease is particularly common in Caucasians and usually presents with recurrent venous blood clots such as deep vein thrombosis or pulmonary embolism. Miscarriage is another finding seen in women with Factor V Leiden. Patients with Factor V Leiden are usually treated with anticoagulants. And now we're actually done with Factor V Leiden. I'll see you in the next one.